as physicians see in young children who are very prone to illnesses where they develop high fevers, they have vomiting or diarrhea, what we see all the time is that the children are often not able to keep up with the amount of fluids that they really need to drink. And what that eventually leads to is something we call dehydration. Now, your kidneys are designed to hold on to or keep as much salt and water inside your body as they feel is necessary to keep you well hydrated. But when you're a young child in particular who can't simply go up to the fridge and open the door and take out something to drink, or when you're a very sick child who's just unwell and can't actually get access to that water or juice on their own, that system doesn't necessarily work very well. And kids are very prone to the types of illnesses that put them at risk of getting dehydrated, mainly because most of the illnesses that you're going to see in your child, especially in their first 5 or 6 years of life, are viral illnesses. And they almost always come with high fevers, which means that children lose a lot of water when they're sweating. And many of them, if not most of them, come with GI problems whereby the kids are having a lot of diarrhea and oftentimes vomiting or nauseated, so they're simply not able to drink well. And I think there are a number of different things that can be done pretty easily even in the home, and things that you can take note of. The first actually sign of dehydration for most children is actually going to be the most obvious, and that is they're thirsty. And it's one of the things inside your body that protects you against getting dehydrated is that there are signals from your brain that actually will tell you you need to drink. And children who are vomiting or have diarrhea will often say that early on, that they're thirsty, and that in and of itself should be a sign to you to start offering them more fluids and more water. Another thing that most children with dehydration will develop is their heart rates will go up. Their heart will be beating faster. Now, this is complicated by the fact that many times these illnesses have high fevers, and that's another reason why children develop high heart rates. But the two together, so the thirst and the high heart rate, are almost always present pretty early on when children are dehydrated. Sure, if you are seeing a child who normally goes to void 4 or 5 times during the day, and now you can't remember the last time that your child had to go and pee, or they can't remember the last time that they had to go to the bathroom and pee, that is almost always a sign of quite significant dehydration and should bring that child to medical attention. In the smaller children, in some ways it's often easier to tell whether or not your child is voiding enough because, of course, many small children are still in diapers. And in general, if your child normally goes through 6 or 7 diapers in a day or 4 or 5 diapers in a day, and again, you now can't remember the last time you changed your diaper of your child, that's a concerning factor if in fact they've been vomiting or had diarrhea and you're worried that they might be dehydrated. What can you do to try and treat your child if you think they're dehydrated or they're becoming dehydrated? To be honest, it depends a little bit on why this is happening, but in general, most children will do better, and most adults, to be honest with you, will do better with very small amounts of fluids offered to them at very frequent intervals. And what we often will suggest is 15 to 20 or 30 cc's of fluids every 15 to 20 minutes as an amount that most children will be able to tolerate. Now, this is more difficult in the younger child and the babies, who often will not necessarily be able to take that amount of fluid on a regular basis if they're feeling unwell. And in many situations with the smaller infants and babies, we simply advise you to be seen if you're worried that they're not getting enough fluids in. I think the most concerning feature or worry if your child has had one of these illnesses and you think that they've not been keeping up well with their fluids is the children that are really in trouble and really need to be seen are often the ones who are becoming tireder, who are not awake as much, more lethargic. And those are children, in particular ones who start to complain or start to feel that they're cold or pale and or occasionally will even develop tummy pains. Those are children that really need to be seen right away.